All right. Good morning, everybody. I have just tweaked my computer setup here, so forgive me as I move my camera around here and adjust things before we get started today. So today I am going to be talking about some questions that have come up regarding service delivery models. I'm going to focus specifically on language therapy because that's the context in which the question was asked. But know that we want to be talking about this question and really considering our service delivery models regardless of what setting we're in and regardless of what type of therapy we're doing. So the reason this comes up a lot with language therapy and with SLPs in the school systems is because there's been a big push recently in the last 5 to 10 years or so, where SLPs who are in the school systems, particularly when it comes to language disorders, for students who struggle with written language, with let me adjust my microphone here, with things like other academic language. The reason this comes up a lot is because there are many times whenever we resort to a pullout model, whenever there is a situation where we are providing services and we are pulling students out of a particular setting, it can be really difficult to figure out how to make that therapy functional and help students to transition and apply those skills that we teach in therapy to other settings. And obviously this applies to things like fluency, articulation, voice. We always need to have a way to bridge that gap with generalization and figure out what the best model is. Now, that being said, we don't want to get married to a certain model. We always want to think from our client's perspective of what is best, because saying I believe in this one model for everybody obviously doesn't take into account that individual's client's needs. Things may look different for one student or client versus another. So the thing is that even if you are in a private practice, even if you aren't in the schools, and if you're just collaborating with SLPs in the schools, you want to be aware of these things because it is important in just understanding the big picture of how this works. So I've got a question that came up this week from someone that I wanted to address on the call today. Obviously, if you're hopping on, feel free to post questions in the chat or interact in the chat as we go. But the thing is that the question that came in was that there's a particular SLP, and this happens a lot with people who are contractors who might only be in a building a certain number of days per week, or maybe they aren't employed directly by the school district and they've kind of got to come in and out really quickly. They might not have a lot of time to collaborate and communicate with other staff. And so in this particular situation, the administrator says, we do inclusion here. That's how we provide our services. So you're just going to have to make that work for your caseload. And the SLP is sitting there thinking, okay, I'm a little uncomfortable saying one size fits all works for everybody. And are there particular resources? Is there a framework that we can use? And do you have any literature that shows what service delivery model works best? And I am going to focus primarily on language therapy for this particular scenario. So I did want to talk through this question because it is relevant, and it's really important that we understand that we can't just say, get on our soapbox and say this one model is best. And we do need to be aware of this so that we can educate other people that we're working with. and honestly, my primary thing whenever somebody says something like this, my administrator is making me do this and I'm worried about pushback, is obviously you want to be educated. You want to be able to establish a good collaborative relationship. You want to be able to defend the models that you are utilizing, but you also want to be prepared for other people to not be open to that. And then that leaves you with the decision of, okay, I'm in this particular setting. I've got to figure out, okay, my administrator is saying I have to do it this way. And I know that that's not best for my students. So you either have to figure out how to make do, or you have to consider, you know what, am I really in integrity here in this setting where I am forced to provide services that aren't good for my clients? And if that's the case, you've really got to make that decision of, do I stay in the situation and try to make the most of it and try to convince people and collaborate with people and change things in this setting? Or do I go to another setting where I am allowed the autonomy of providing the services that I know are best? Because what that's going to do is that it just allows us to number one, get better at providing good services. And that's only going to cause kind of a domino effect of, the more people that are in systems where they can provide good services, the more case studies and the more evidence we are going to have that's going to support those good service delivery models. So really the question is, if you're in a situation that you know isn't ideal, do you choose to stay? So that's always the thing that I say. So when people ask me questions like this, I usually say, okay, I'm going to give you that information that you need in order to know what is the best and how to problem solve in that particular situation, so that you know what service delivery model is ideal and how to use that information to figure out what would be the ideal situation in your setting. Number two, have that information to go to so that when you go to those collaborations with other people, you know what your stance is and you have some literature to help educate them. Obviously, just shoving articles in their face isn't going to be the best thing. That's a whole nother conversation, the conversation about collaboration, because obviously just citing a bunch of research articles isn't necessarily always the best way of convincing people of something. That's a whole nother conversation. But so obviously you do want to have that information for your knowledge so that you know where you stand. But then you also want to be open to the idea of, what are my other options? Can I start looking for a job somewhere else where I know that I'm going to be with a team that's going to help develop me and my skills? Because that's only going to further your knowledge in all of those different areas. It's really hard to get good at your job when you're not allowed to be good at your job. So all of that being said, what I am going to talk about today is the actual evidence that you need in order to figure out what service delivery model you want to utilize for your students with language therapy. So again, keeping in mind that the whole job search, that's a whole nother skill set. The whole collaboration piece and the interpersonal relationships, that's a whole nother piece. We're just going to talk about the evidence behind service delivery models today. Knowing that this is just one part of the equation. So what I'm going to do is I'm going to share. So the question first proposed was, what literature do you have? What's available? So I'm going to show you what my go-to method is whenever I want to look for articles on a particular topic. I'm going to share the research that I've done on this particular topic and some articles that I've written with some references, but I also want to show you the methods by which I've done that research, because since I've written the articles that are on my website, there has been some other research that has come out, but the ones that I've written are a good starting point. But you also want to have that method and that process in your toolbox, because other things are going to come up that are going to help you to figure out what methods are best for you because you do want to be aligned with evidence-based practices. So what I'm going to do first is I am going to show you one of the ways that I do searches when people give me questions, clinical questions, and when I do research for some of the articles that I write on my website and things like that. Now, obviously, when I was going through my doctoral work, I did have a lot that I did during my doctoral work. So compared to somebody who has been 100% focused on clinical practice versus what I was doing, where I was in the schools, but I was also doing research, obviously I have focused more on that just because of my doctoral program. So I guess that does give me kind of a head start, because I did focus on that for many years, compared to somebody who's 100% focused on clinical practice. So keeping that in mind, but this is also, since I've graduated, I do need to stay up to date. So what I do, and this is helpful for you. Obviously, there are other resources out there, other journals out there that if you are an ASHA member, you do get access to certain journals, but you don't get access to all the journals. There are a lot of good online forums that can share research and things like that. But I'm going to focus on one that's already readily available to you, which is the ASHA publications. And this obviously is available to you if you are an ASHA member. So I'm going to, let's make sure I'm sharing the right page here. I'm going to share my page. And so what you should see here is that I have, let me get my page up here. Okay, so this is the, these are some of the journals that are available through ASHA. So obviously you've got the actual research journals, so American Journal of Audiology, AJSLP, American Journal of Speech Language Pathology, Journal of Speech Language and Hearing Research, and then Language, Speech, and Hearing Services in Schools. And then we've also got the ASHA Leader, which has, it focuses a little bit on research, but it's not actual studies. And a lot of times it's more editorials, news, things like that. So good resource to have, but for empirical research, you're gonna wanna look in these journals. The interest groups, if you are a member of those interest groups, those are also good resources. They have some forums. But when I am doing my research, I focus the majority of the time over here. So if you are an ASHA member, you're going to want to make sure that you are signed up via their online website, because then what you can do is log in here. I'm already logged in under my account, and you can get full text access to the all of these ASHA journals. So are those all of the journals that are available? No, but there's a lot in there. So before you worry about other things, let's talk about what you already have access to. So what I did, and what I did earlier, when I was looking up some of these models, is I went to my go-to, especially for issues with schools, is obviously I go to Language, Speech, and Hearing Services in Schools. That's one of my go-to resources. So when the question came up about what's the best service delivery model in the schools, this was my first place that I went. Now, obviously, there are other good articles about language therapy in some of these other journals, but if it's a school-based issue, a lot of times I start here. So you're gonna go, and this brings you to the very first page of the most recent articles that were published by Language, Speech, and Hearing Services in Schools. And then you can go up here to the search function, and you can actually search specific topics. So you can actually scroll through the issues chronologically here, and it'll start with the most recent. They've got the newly published ones right here. And then there's some other things right here, the homepage. But what I usually do is that I'm going to start here. So I'm going to go up here and type in service delivery models. And then I'm going to just hit search. And that's going to bring up all the results. So it sorts by relevance. So for example, we've got this one up here that was published in '91, so it's a little bit older. Doesn't mean it's not relevant anymore, but you always want to keep in mind how current it is, because there could have been updated research that has come out since then. But then there's also all these other articles that you can look at that will give you some information about service delivery models. So I will tell you that I have scrolled through a lot of these, and I'm going to give you kind of the Cliff Notes version, but I highly recommend, if you have a particular topic that you want to know more about, that I would, if you are in the schools, I would highly recommend starting with this resource, and then, go through this one, type in some different search terms up here, see what comes up, and then you can always check the other journals as well. So first thing, what I do is I usually start with this, whatever my first search term is. So for this example, service delivery models. So I have reviewed or referenced a lot of these articles on the blog. One that I highly recommend if you are working with an administrator who says, you know what, you've got to provide services a certain way. for language therapy, I highly recommend this article here. This is a systematic review of all of the different service delivery models for communication for elementary age. And so it's very interesting. I will give you kind of the synopsis, and I will share some blog post articles that I've written where I've talked about this study in more depth. But basically the synopsis was there really hasn't been a lot of research that shows that one service delivery model is superior to another. And a lot of the research that has been done has not had really solid methodology. So it gives us some more information, but it is limited. So that's why I recommend starting with this one. Again, Kieran et al., published in 2010. So 9 years ago, still fairly recent. There have been some more recent studies since then, but I recommend starting with this one because it does give you a good review of the evidence that's been published in the last 30 years. So it's not to say that, for example, in this particular situation where the administrator wants the SLP to do more inclusion is likely a very, very good model for a lot of the students that might be on that caseload, at least some of the time that you're providing services. But the main point that I want you to take away from this is that we have to be aware of what the research has shown us and not just automatically go there and assume that it's best for everybody. So what you'll find is that in this particular study, I'm going to click over to the full text here. Hopefully you can see that. Again, they did peer-reviewed articles from the last 30 years. And you can download the full text if you click on PDF here. So I recommend reading through that. And then what I recommend doing from there is looking at some of the specific studies that have come up in that review. But the synopsis of the article was that it's really more important to be collaborating with teachers and have an understanding of what's going on in the classroom rather than always physically being in the classroom. Physically being in the classroom definitely makes it more likely that you're going to understand how to make that therapy functional. It doesn't mean that 100% of the time that inclusion is the only option for being able to do that. So what I will recommend doing, I'm going to talk a little bit more. Let me just go into a couple methods for finding articles, and then I'll talk a little bit more about the specific question about what the research says about inclusion. But what I recommend doing is that when you find some kind of comprehensive meta-analysis like this, or if you find a study that's been done really recently, even if it's just, an individual study. I like this one as well because it's a systematic review, not as intensive as a meta-analysis, but still very helpful because they've looked at a lot of articles. What you can do is download the PDF and then look at the reference list, because we know it says conduct an evidence-based review of peer review articles from the last 30 years, it's going to include a lot of references. So what you can do is then look at those references and see if you can find some of those in these ASHA journals here. So if a lot of them have been published in these ASHA journals, you can get the full text of those. So you're using the search that you've done. You're looking at the articles that are cited in this study to help expand your search. So I recommend using both just a keyword search here, and then also doing they call it an ancestral search, where you actually look at the articles in that article and then read those articles. So that's a good way to find more information on a particular topic if you maybe only find 1 or 2 articles. So I recommend doing that. That can be a really helpful way to find articles. Obviously, it only gives you access to ASHA journals, but this is a really solid start. There is a lot of very good research in those journals. So that is the method that I have done for a lot of the information that is on my site. So with that all being said, that's the method I've used, and that is how I came to find this study, one of the methods. But what I want to do now is just take a quick, just do a quick synopsis of a specific answer to that question about service delivery models. So what I'm going to do is stop the share really quickly, and then I'm going to pop over to an article that's on my blog where I do go through some of that, I guess, just philosophically, some things that I found from that research review, and based on service delivery models, and just some things that we kind of assume about service delivery that might not always necessarily be true. So the direct link, I'm going to share the direct link now. What I want to talk about here is not necessarily the treatment technique. I do share some links in this particular article to some information that explains some specific techniques, but I want to talk a little bit more about just the big picture around service delivery. So let me post this link to that article there. Okay, so let me share this really quickly. Okay, so really just talking about push-in, pull-out co-teaching and what's most effective for language therapy. And so the whole purpose behind inclusion and co-teaching is that number one, there's a little bit of a political agenda there where it's kind of like, you know, we want to include those students in who are in special ed. We want them to be included in all of these things and have access. And we absolutely do want them to be included and have access. But what we really want is for them to be in their least restrictive environment. And what's the least restrictive environment for one student might not be the same for another. So for example, there might be a student with a learning disability who their least restrictive environment is for them to be in a general education classroom for most of the day, occasionally with some support from somebody like the special ed teacher, a speech pathologist, a teaching assistant, maybe even the teacher themselves with certain accommodations. So that might be the least restrictive environment for many students. Chances are, if you've got students on your caseload who have mild language disorders, the least restrictive environment might be something like a hybrid. Sometimes you're pushing into the classroom, sometimes you're doing some structured things in small groups, or maybe in a pull-out situation and then reinforcing them in the classroom, something like that. So that being said, that's not the least restrictive environment for everybody. For other students, the least restrictive environment might be a self-contained special education room, a one-on-one aid, or, you know, again, special education full-time, or maybe they're in special ed and they just come out for specials and things like that because they can't fully access a curriculum and they need things taught at a slower pace or specifically individualized, and maybe something that's beyond what can be provided in the general education classroom in order for them to make progress. And in that particular situation, the least restrictive environment is not pushing them into an inclusive setting. So we can't make that assumption. So rather than say, I am an inclusionist or I'm someone who recommends inclusion, what we should be recommending is a least restrictive environment for our students. And in order to do that, in order to make our therapy functional, we need to be providing therapy in that least restrictive environment. And so honestly, if your administrator is saying we do inclusion, well, yeah, you probably should do inclusion for a lot of students, but it doesn't mean that you need to be doing it for all students. What you need to be providing is instruction at a level that allows students to access a curriculum. And even for those students who are milder, for who might be able to be in the general education classroom for a good portion of the day, we can't make that assumption. And sometimes we do need to pull them out to provide individualized instruction on specific language tasks. That's the case for even students who have mild issues. So we might still, a lot of times, be able to provide that instruction. The best scenario for some of those students to learn some of those language skills might be a pull-out setting. So really, the thing is that there is a lot of evidence that shows that for students who struggle, and this is where I go with why it's okay and sometimes even beneficial to provide some services in a pullout setting, even for kids who have mild language disorders. It doesn't mean that that's the only thing that we do, but it does mean that you can still make a big difference, even if you're doing pullout. And sometimes you should be doing pullout, because a lot of times that high-level comprehension work that's being done in the classroom is not necessarily what those students need. A lot of times they do need that structured work on syntax, morphology, vocabulary, and in the classroom, they're kind of moving on to that high-level comprehension work, writing paragraphs, things like that. If they don't have that solid sense of sentence structure and vocabulary, then if all you're doing is teaching that high-level comprehension work, your students aren't going to benefit. So what you can do is that, yes, some of your therapy might be focused on pushing into the classroom and reinforcement, but you do want to make sure that you're providing that intensive intervention on those skills that are more foundational. So really one of the myths that is behind a lot of people saying like we have to be doing inclusion is that the only way to build those high-level comprehension and cohesion skills is to work on them directly. So for example, this means if they're struggling with comprehension, by working on comprehension questions and retelling and summarizing, or by working on, the only way to work on writing skills is working on entire paragraphs. Well, that's just not true. There's a lot of times that we can improve functioning on those higher level writing skills and that overall organization of your paragraph by working on specific syntactic skills, by giving our students those foundations. It's absolutely not true that the only way to work on those skills is by doing things the exact way that they're being done in the classroom. So that's why it's okay and even beneficial to be providing students with services that might be a little more structured, that you can deliver in the small group. And the thing is that whether you're doing it in a classroom in an inclusive setting and whether you're doing it in a pullout is irrelevant. It's more about, are you focusing on the right skills? So when you're problem solving and trying to figure out, like, can I make this work? Yeah, there might be some times when there are certain skills you could probably teach it in the classroom if you kind of had your small group or your station where you're working on those particular skills, or you could be pulling them out into your therapy room. So there's a lot of times when we could go either way with in the classroom and outside of the classroom, but it's more about, does that student need those foundational skills and vocabulary, and am I providing it rather than am I pushing in or pulling out? So a lot of people sometimes get stuck on the service delivery model, but really what's more important is, what are you actually doing when you are in the classroom or when you're pulling out? A lot of times we can actually make our therapy look pretty close to the classroom, just a smaller group. So if you're able to do that, then it's perfectly fine to deliver your therapy in a pullout setting if you're working on those correct skills. I do, in this particular article, give you some references as far as explaining why we need to work on some of those foundational skills. And so something that you can use for a rationale is, our students need work on these particular skills. And when I'm pushing into the classroom, the teacher's not working on those things because the teacher needs to be moving on to these other skills to keep up with the pace of the class. And my students over here need work on these things in order, whoops, sorry about that. My mouse just fell on the floor. Our students need work on these more foundational skills, and that's not what the teacher is working on. So I do need to pull them out and provide this reteaching and instruction on these foundational skills. So sometimes it's not a matter of these things can't be delivered in the classroom, but more like we need to divide and conquer. And when I am going into the classroom, logistically, the teacher's working on these things and my students need work on these things. So in order for me to provide this particular type of instruction, I do need to pull the kids out over here. So that's one rationale that you can use. And again, it's less about where you're providing the services and it's more about what you're actually working on. So the thing is that sometimes it can be a little more difficult to control the intensity of instruction and the amount of repetitions that students get when they are provided of opportunities to use language skills our students need when they're working on syntax and grammar and things like that. A lot of times they need a lot of practice. They need a lot of trials. And when you're sitting there listening to the teacher explain, like I remember being at a time that I was doing co-teaching, and I, for the entire first half of class, was sitting there and we're sitting there listening to the teacher explain the writing assignment, which is an important part of the class. But for that entire 40-minute period, I really only got about 5 minutes to actually sit there and give my students practice. So it got very watered down. So if that's happening, that is definitely like, even just that evidence right there saying like I was pushing in and this is the only amount of time that I got with my students, it's just not enough for me to be able to provide work on these particular skills. Or even showing, you know, there's evidence here that they need work on syntax and they're not doing that in the classroom. So I need to actually provide these additional strategies over here. The other thing, you know, again, just the mindset of, well, if therapy isn't functional if we're not working on the exact skills that students do in class, again, like I've been saying, you want to make sure, because a lot of times what happens is that when students get into their classroom, we see symptoms of a bigger problem, like they're not following directions, they're not able to comprehend what they read, their writing is very unorganized. There are times that it is going to be appropriate for you to be in the classroom reinforcing some of those skills, or training the teacher to be reinforcing some of those skills. With that being said, if that's all you're doing, you might not be providing the adequate work on the root cause of the problem, which would be, you know, again, that they can't put a sentence together or that they don't understand the rules of grammar. And so a lot of times what happens is that when you're in the classroom, for example, when I was in the classroom doing a writing assignment, my students needed work on, for my students, we were working on complex sentences, and we had to wait, you know, for the teacher to explain the process. And then then they were taking notes, and then they were finally writing their sentences with 10 minutes to go. And we'd barely done any work on the actual sentence structure that we were working on their therapy goals. And then the other thing is that once they actually did start writing, there were only so many opportunities for them to actually write that sentence type that we were working on. So again, it got very watered down. There wasn't adequate work on the symptom of the problem. And then of course, because they're struggling to put sentences together, the cohesion of their paragraph wasn't very good. So there was a lot of, there was not a lot of work going on the root cause of the problem, which was their poor syntax and vocabulary. There was a lot of just, you know, again, trying to get them to put it all together without getting them to build those foundational skills. And the thing is that because of that, that's why I say that this is a myth, that it's actually, if you are building those foundational skills that students need to be able to do those higher level cohesion tasks, it's actually okay and perfectly functional for us to be working on those skills that are going to give our students that foundation for being able to do those harder skills. So that's why it's okay if your therapy doesn't always look exactly like it might look if you were in the classroom. So because of that, we actually don't want to necessarily assume that pull-out therapy isn't functional, because sometimes it's the only way to be able to deliver the correct intensity of instruction and provide enough focus on those particular skills that our students need. So what I would recommend is that if you are struggling in language with your language intervention with an administrator who's saying you've got to provide it this certain way, I would give them evidence of a couple different things. Number one, right here, and again, these are cited at the bottom of this article, I would show them this article right here, this Kieran et al. That did the systematic review of a lot of different research that was done over the last 30 years. And so that showed that there wasn't one clear service delivery model that was beneficial. So if somebody's saying like we have to do inclusion, there's really not a lot of evidence that shows that is the one only way to go. So I would show them that study, share that information with them. And then I would also show them this one. And the reason that I'm pulling this one out, even though it is a bit older, is that this is one of the few studies that actually had a good methodology and that actually showed some significant evidence about what does work. So this Thronberg et al. Study showed that when there were some key factors that actually did make an impact on students' vocabulary skills. And so they compared just being in the classroom with collaboration and then just being in the classroom. So for example, what they found was that when the SLP was in the classroom providing vocabulary interventions, that there were significantly better outcomes. The students had better vocabulary skills after the intervention when there was good collaboration between the teacher and the SLP as compared to just being in the classroom alone. So that's why I say making therapy functional isn't about whether you're pushing in or pulling out. It's about focusing on the right skills in the right places at the right time and keeping everybody on the same page. Because what happens is that when there's good collaboration, you can make sure that you are in your therapy providing focus on the right skills because you're communicating with the teacher, so you know that you're doing the right things in therapy. And then the teacher knows what to reinforce. And then when you come together and co-teach, you know that you're actually just working on things that are going to bridge that gap. And the problem is that if you're just kind of jumping into the classroom without good collaboration, there could be this huge disconnect between what's going on here in therapy and what the teacher's doing over here. It doesn't mean, like, for example, in my situation, the teacher had something that she had to teach in writing. So I'm not going to tell her not to teach that. But what we are going to do is collaborate and figure out, okay, when's the best time for me to come in? And how are we going to structure that lesson so that it's beneficial to what she needs to teach in the classroom and beneficial to what those students that I'm in there for, who I'm in there for, actually need, so that it actually is a good bridge. And it's not just me kind of coming in and basically floating around like a teaching assistant would and having it be totally disconnected. So the key to being able to focus on the right skills in the right context and doing it well is that collaboration. It's not simply about the service delivery model. Service delivery model, of course, is relevant because when you have good collaboration, you're going to figure out what service delivery model is best. And that's why a lot of the articles that I pulled up for you when I did my search were, for example, there's a couple of articles by Marilyn Nippold where she really talks about how it's so important for us to just get out of the standard pullout model. It's so important for us to, and she says, be in the classroom. But we've got to stop thinking about it as when we say be in the classroom and get out of pullout, what we really mean is not just like we're just going to go in there and co-teach. What we really mean is that we need to be we don't want to be on this little island here, like this pull-out island. If you are collaborating with the teachers, then you're aware of what's going on in the classroom, you're going to know, you're going to have a better idea of when you should be pulling out and when you shouldn't be. And the thing is that if you're only doing pull-out and you're never talking to the teachers and you're never in the classrooms and you have no idea what's going on, then of course, yes, like Nippold had said, of course, that's not going to be very functional for your students. But we don't want to throw the baby out with the bathwater and say that that model is broken 100% of the time. So what we do want to do is start forming those relationships with teachers so that we can figure out how to have this nice hybrid continuum of services. Now, the way that I have found it to be a good transition is that I am focusing on a lot of those foundational things in a pull-out situation. And then I'm starting to, in my pull-out sessions, work in some of those high level, once we've had adequate work on some of those foundational skills like vocabulary, grammar, syntax, and those types of things, then I might start working in some of those things like like narrative skills and writing and reading comprehension, start to touch on that a little bit in therapy, but then I'm gonna eventually want to have a model where I'm working on those types of things in the classroom. And in this article that I shared, I do explain a little bit about how I make that transition to what I'm doing in the therapy room, and then seamlessly transitioning that to a framework that actually works in the classroom, that is language based, and that also fits in with what the teacher is likely going to be doing in the classroom anyways, or that's going to be a little bit more in line with what's going on in the classroom. For those kids who, you're working on those foundational skills and you're thinking, you know what, a lot of kids might benefit from just that pull-out instruction, but you might have some of those other kids who will need you to then take the next step and actually do something more functional, pull it together for them, and possibly even do that in the classroom. So this framework that I teach in the video, again, it really is focused more on narrative skills. That's a really good way to make that transition to pull out and have a protocol that you can actually use in the classroom, that you can present to teachers, that makes that collaboration a little bit easier. So I share that in that video. But really how it kind of works is that when I'm making that transition to being in the classroom more, I am focusing on the structured stuff in pull out, then gradually pulling in some of this cohesion stuff, like narratives, into some of my therapy. And then when I'm in the classroom, then I've made that transition and I'm working on that narrative language and those higher level cohesion skills once I get into the classroom. And I might still be doing some pull out therapy over here, but I am starting to work some of this other stuff in. So that's how I use it. And I do have some, like I said, some references for a lot of these, again, the narrative protocol and the some of the articles that talk about reading comprehension and why we need to work on some of those foundational language skills. So I recommend checking out some of those references in this article to help support your case when you go talk to your administrators. That will help you make the case that there are certain skills that we need to work on, and it doesn't always matter what setting we're in, as long as we're doing it, we're working on these skills. And then number two, that there isn't one service delivery model that's a clear winner. So we've got to make sure that we're collaborating so that we can come up with a good hybrid approach there. So those are some resources for you that will help you get started. Again, definitely use if you've got an ASHA membership, you should be able to log into the site. So you can use that search engine there, and then also use some ancestral searches to come up with some articles. But I've also shared this one here that's got some links to articles as well, so that you know some of the research that's already out there. So you've got a starting point. So with that being said, that covers everything that I wanted to cover today about co-teaching and service delivery. So let me know what other questions you have. Again, part of this is knowing how to, knowing the research, but also knowing how to communicate that research. So obviously that's a whole nother conversation, but the starting point obviously is knowing your stuff and knowing what the evidence shows. So with that being said, we'll go ahead and wrap up for today. If you are watching the video and in the members area, feel free to leave a comment below the video if you've got questions. And if you've got questions coming up for future calls, go ahead and email me at talktome@drkarenspeech.com, and I'll be sure to put them in the queue for you. So thanks so much, everybody, for watching, and have a great day.